Thank you for joining us today for the Health and Wealth Network. Today we are doing a Medical Financial Partnerships video series spotlight. With us today is Dr. Adam Schickendanz, Assistant Professor of Pediatrics at UCLA. Adam, thank you for joining us today. We're so glad to have you. We've been working together for a long time, and I know that you're primarily a pediatrician. So how did you come to this health wealth connection?
Lots of reasons. I think the main reasons have to do with what are the primary drivers of worse health outcomes for children as a whole, children at a population level in the US. Even though there are many children who have serious medical problems and chronic medical conditions, compared to adult patients, adult medicine, most kids are fairly healthy. They don't have medical problems that are diagnosable in the current medical model. And our job as pediatricians is to keep them as healthy as possible, knowing that the better we do at improving their health during childhood, the more likely they are to have a healthy life and adulthood. And part of improving their health in childhood and on through the life course is preventing financial stress from poverty and the health impacts of poverty. And given what we know and have known for as long as the field of pediatrics has existed, pediatric providers understand that poverty presents a litany of health threats in terms of mental health of the parents, healthy child development, basic needs like food and housing, threats to those essential foundations of safe and stable childhoods. And we've learned more and more over the last 10, 20 years, especially about the direct health impacts of financial stress. So we know that children's brains develop differently in the context of the toxic stress of poverty compared to their higher income peers. We know that children's cognition and development is impaired, not irreparably, but is influenced by poverty and the threats that their families experience as a result of not being able to make ends meet. So it's all part of what we do in pediatrics to address poverty as a health threat, to put on to take the lens of preventive medicine, right, and prevent worse health outcomes for our kids by addressing the most material threats to their health. And one of those main drivers of worse health outcomes we know more than ever is poverty. The other way that it's come up for me, and that was sort of like the general, conceptual reason, right? But it's also been very clear from the beginning of my career that my patients are experiencing health problems as a result of poverty. My ability to help provide the best medicine that I can is also influenced very strongly by my patients' financial circumstances. And it's really inescapable, right? So as an example, early on in my residency training in pediatrics, in my first clinic where I was, the primary care physician, pediatrician for the families that I was working with, and got to see them over time and build relationships with them over time and be their primary doctor. In that first month of that clinic, I was training in San Francisco, and one of the very first families that I worked with in that clinic, when I asked them what I could do to help improve their health and the health of their baby boy, the first answer that came out of their mouth was, "Help me find a job." The mom said to me, "Help me find a job." That's the thing that I think is going to be the biggest health problem for me and my family going forward if I can't put food on the table. And this is a mother who had been through a recent hospitalization with her son. Her son had had a urinary tract infection that had caused, a bacterial infection in the blood. Was quite sick, needed antibiotics in the hospital for over a week. That mom had been there with him through the entire hospital course, all the ups and downs and some very scary moments. And so there was a lot of medical stuff going on for that family too. that she could have been worried about. But it was really her employment that was top of mind, because all the rest of the stuff was fairly manageable from a medical standpoint. And to make that linkage even more clear, it was actually the fact that she had been in the hospital with her son during that hospitalization, to make sure that things that she understood was going on, that his condition was improving, that by virtue of that, doing her due diligence as a mother, she was unable to work during that time, and her employer, unfortunately, let her go. And so she lost her job as a result of the medical care that she and her family were receiving, and unfortunately didn't have legal recourse to get it back. So in a sense, by doing the right thing as a caregiver, the healthcare that she received, given our patchwork sort of protections for families and caregivers when they're taking care of their loved ones in this country, she was at risk of financial collapse and experienced, a huge financial shock, and had enough sense to look to the pediatricians who were caring for her family to help her get out of it. And luckily, we were able to do that. Over time, it took us building, a financial fitness clinic, which was one of the first medical financial partnerships that I began to work with and work on, to get those systems in place so that we could actually address her financial issues as a health threat. But that was the light bulb moment for me when she was first brought that to my attention. It wasn't the last time either. There were other families that said exactly the same thing in the months and years ahead. And ever since then, I've recognized it when families are surfacing financial issues as part of their health concerns, and it's ubiquitous.
Right. And especially we're seeing that play out right now in this global health pandemic. We've seen the connection arise between health and wealth. How are you seeing this manifest during the COVID times?
Yeah. As I said, it's always been there, and anybody who's been paying attention to it has recognized it. COVID has just amplified it, right? Has really increased the severity of financial stress on the average family. For those families that were already experiencing severe poverty, or even were just barely making ends, it's pushed them over the economic cliff, so to speak. And everybody, I think, in our society is now much more aware of the fact that COVID has increased financial stress on so many families at the same moment that the communities that are most at risk for the economic fallout of this pandemic, are the ones that are suffering the highest rates of disease. And so we're talking about health and wealth issues in the same breath, right? As we discuss COVID, I'll tell you that in our clinic we're seeing across the board that families, especially early on in the pandemic, where there were shortages of parenting supplies, couldn't find diapers, couldn't afford diapers, were having trouble finding formula. Since the beginning, we've heard from families that they've had severe, job loss or job hour reductions. So their incomes have declined substantially, and they're wondering what they're going to do, right? When the moratorium on evictions expires in the next, month or two. Luckily, in California, we have a little bit more time than the federal the federal moratorium deadline. But we have a real huge challenge ahead of us as a society, thinking about how we can address the economic fallout, and we've seen that in the clinic with the families that we work with. I think I hope that as a result of this shared threat and shock that we're all going through. Now we're all going through it differently. I'll say we're all in the same storm. We're not in the same boat, right? As the phrase goes. I just hope that there are enough people who are thinking about how to find solutions to both problems simultaneously, that we can actually make some real progress in terms of reshaping the healthcare system and the economic system, such that they're working in concert and are really, mutually reinforcing the importance of promoting health and financial well-being simultaneously, because you can't separate the two.
Right.
As all of the evidence, pre-COVID and post-COVID would have shown, the social gradient in terms of income and wealth is hugely predictive of health outcomes and morbidity and mortality in this country, chronic illness risk, whether you're talking about in pediatrics or in adult medicine, adult disease. So it's time for us to actually reshape our systems of financial well-being and health, to recognize that fact, and hopefully there's enough professional will and political will, and that this crisis might have a silver lining of actually moving us in that direction.
Right, and let's hold on to that hope for a moment and talk about where you see opportunities for the financial capability field and the health sector to collaborate and build some potential solutions for health and wealth.
It's worth mentioning, before getting into some of the specifics, that financial well-being and physical well-being are mutually reinforcing and bidirectional. So as I mentioned, poverty in early life predicts later life health outcomes as well as childhood health outcomes. And as any sort of economist who's been working in the connection between health and wealth will tell you, people's physical and mental health has everything to do with their economic productivity and their employment. So it's really cyclical. Those relationships and mutually reinforcing. So that means that there are opportunities for the financial capabilities service field to improve upon healthcare, right, and the models that we put in place to improve health at either a population or community level or face to face with folks in the clinic. And by the same token, there are opportunities for healthcare and health systems to augment and to supplement financial capability organizations and programs to make them more effective as well. So I see this as an opportunity for supporting one another, right, and cross-sector partnerships that are really mutually beneficial. There are just so many ways that we could be collaborating, and I've been involved in moving financial coaching into clinical spaces so that patients can get connected to financial coaching and those services there, work on their asset building, debt reduction, and income, and employment improvement, employment opportunities. Other people have built, free tax preparation sites into clinical spaces, or have built close referral partnerships between clinical operations and local organizations that are doing, financial capabilities work. And all of those are great examples of medical financial partnerships. And I think there are many, many more that we have yet to sort of discover. And really the medical financial partnerships that have been most successful are ones that are responding to the needs of their local communities, and that are built on mutual trust, ongoing conversations and collaborations between health and financial systems, and relationships and conversations that help us jointly identify a shared problem, right, at the root of maybe worse health outcomes or worse financial health, that the communities that we work with identify as a real priority that they want to fix. So, whatever we do in these cross-sector partnerships between health and financial well-being, it ought to be driven by the communities that we're serving, right? It needs to foreground their voice and respond to their needs. And I think I really do believe that there's there are endless possibilities. Healthcare is vast in terms of the types of medicine that are available that address every imaginable type of medical condition under the sun. We have specialists in all sorts of areas of health and well-being, and in the financial capabilities field, they're experts in various types of financial issues as well. So all of that variation and complexity means that there are infinite almost opportunities for our fields to collaborate and address specific problems that sort of exist at the intersection of those of our fields. So whether it's preventing medical debt in high utilizing patients, or in folks who are receiving cancer treatments, or preventing poverty in the first place in kids who are receiving pediatric care, or something else. I think the possibilities are endless, and it's really just a matter of us partnering and beginning the conversation, figuring out where we have shared opportunities and where our agendas overlap, and then getting creative and partnering that way.
So as part of that creativity, you've been working on medical financial partnerships for a while now, and you're actually part of our medical financial partnerships working group. Why do you think this is an important space, and what have you learned during your time with us?
It's the most concrete application of the conceptual notion that health and wealth are intertwined, right? So I'm a person who, I love learning, new things conceptually. I love understanding the world in different ways, and I really want to apply that knowledge, right? So because I see families, I see kids who I know are embodying, right, that relationship and between financial stress and worse health outcomes. And I want to do something. And I think a lot of us in our fields, we're doers, right? We're folks who want to try something new. We want to innovate. We want to push our fields forward. So medical financial partnerships are really the application, right, of the conceptual knowledge, and for the purpose of improving the health and well-being of our communities, which should always be our ultimate goal, and the measure by which we determine whether we're being successful. So what have I learned? I've learned a ton from my colleagues in this field, both on the financial capability side and also others from various fields, social work, healthcare and other fields of healthcare, public health professionals, and social scientists who are doing this work in other places. So, early on, around 2010 or 2011, when I first started doing medical financial partnership work, and where I first met that family that kind of flipped the light switch for me, I didn't know anybody else who was doing this kind of programmatic work. I didn't know that such a thing existed. I just thought that it made some sense, and I wanted to figure it out for the families that I was working with. But slowly over time, over the last decade, I've met more and more people who have been doing work in their own sort of neck of the wood, along the same lines. And it's been such a revelation to actually connect with folks who have done this for longer than I have, folks who are starting out but have a different perspective, and colleagues from not just within the U.S. but actually internationally, who have taken slightly different approaches but with the same fundamental principle of trying to address trying to address financial stress as a health intervention. So I've learned techniques around how to implement these programs more effectively. I've learned about financial services. I really appreciate my colleagues on the financial coaching side who have taught me infinite amounts on how to approach dealing with financial issues. And all of it has gone into, increasing our ability to actually deliver medical financial partnership services. It's been fun, through through the learning network and through the working group to actually be able to have those conversations more routinely, right? So whereas 5 years ago, or even further back, those conversations were sporadic. It was sort of an informal network of individuals who were interested in this space. Now that we actually have a learning network and a working group, I love being able to check in regularly with everybody in the network, share ideas, share best practices, get updates on what they're experiencing, what they're seeing on the ground, figuring out with them, what are some best practices that can be applicable to the work that we're doing here in LA. And just that, that sharing of ideas, that cross-pollination is so helpful, both for keeping things new and exciting, but also for just building network and building community around this, and moving towards what I hope will become a field, at the intersection of our two sectors over the long term.
Right. I think it's really important when we create these spaces to uplift best practices, to find solutions to the problems that we're trying to fix, but there's so many ways to tackle the same problem. So what would you say to policymakers, philanthropy, financial institutions that want to respond to this health wealth connection?
Lots of things. I think what I'd encourage first and foremost I would emphasize the importance of recognizing how finances and health work together or work, in opposition, depending on how the structures, the health promotion structures and financial structures of our society are organized. And right now, because the two systems, the two sectors have not been thinking about their spillover effects, and the sort of implications of their sectors for the reciprocal sector, health has not been a primary consideration of how we've built our financial services in this country. Likewise, financial well-being has not been a major consideration in health services. I think that gap in our ability to plan for the financial implications of healthcare or the health implications of financial services has everything to do with the ways that these systems fall apart in our society right now, or not functioning as well as they could be, not nearly as well as they could be. And also why the disparities exist, right, in terms of who is benefiting from these systems most and who's left behind. So we need to change that. We need a health and all policies approach, health and all fiscal policies approach to actually consider what are the health impacts of how we structure the financial policy in this country, from tax policy to just the services that are available within communities to help families get ahead. Likewise, on the healthcare side, I think it's abundantly clear, and has been for a long time, that healthcare is one of the biggest threats to financial stability that families face in this country. A single medical bill can wipe out family savings easily, and is one of, if not the leading cause of bankruptcy in this country. So we have a lot to do on the healthcare system side to make sure that we are being responsible when it comes to protecting finances for our patients. And that comes down to policies, right? It comes down to the policies about how the healthcare system is reimbursed, what protections are in place for patients once they receive care, for our insurance system and structures. All of that has huge impacts on financial hardship for families that is almost completely unaddressed right now. For philanthropy and others, I think again taking an approach where foundations explicitly name this intersection of health and wealth, right, in how they approach their investments would be huge. Would push us light years ahead of where we are now, and make sure that we're developing solutions, right? As we talked about, this moment that we're in with COVID is a huge opportunity for us to develop solutions and push systems further actually be much more effective in addressing health altogether. So we should capitalize on that opportunity, right? And foundations should make sure that their investments move us in the direction of a future that both healthier, but also more financially stable and less inequitable, more equitable than we are today. And the specific examples of what that could look like, would take days, weeks, to list. But I think just that shift in perspective and that recognition alone, if we can just maintain that in mind, would do wonders. And we'll figure out exactly what the right ways are to apply that, and ways that we can sort of systematize and routinize that as we continue to maintain it in mind. But the first step, kind of shift in mindset towards that framework.
Well, thank you so much, Dr. Schickendanz, again, for joining us, for sharing your thoughts. We really appreciate you taking the time today to just talk with us. Thank you, everybody, for listening in. Just a reminder, sign up to join the Prosperity Now Community's Health and Wealth Network if you're interested in more about this topic. And see you all next time.